Hello, my name's Matt Flegal, and today I'm going to be talking about methods to avoid some of the common or less common study pitfalls with in vivo studies. By way of background, I've been working in the laboratory animal research field for about 31 years now, and I have been running teams and departments who focus on this work for about the last 17. So I'm going to start a little bit differently because I'm going to start with a case study. This is an illustrative case study, so it's one that I worked on about 20 years ago, but it incorporates a lot of, let's say, the concepts or the ideas that can cause these studies to go off the rails. I'm going to be talking about a ferret radiotelemetry model that I worked on. It was a really interesting model. It was also one of the most frustrating models I've ever worked on. But it was really important, right? Because especially at the time, this was when the regulatory agencies were primarily focused on QT, so a segment of the ECG prolongation, as an indicator of sudden cardiac death. And so that was one of the absolute key safety pieces for any drug going to market is, do you have any QT segment liability? And if you do, you're probably not going to market. And so the project that was put in front of us is, how do we do that as soon in the developmental process as possible? Because you don't want to find out when you've just spent $150 million that, oh, well, here's a liability. How do you push that forward so you don't waste resources, be they people's time, be they the lives of laboratory animals? How do you answer this question as quickly as possible? And so we looked at that and we went, yeah, that should be doable. It's an established study design. We've run that in any number of lab animal species. It's an established procedure. We know the devices. We know how to place them. It's an established technology. It's just putting it into a new species. So this should be straightforward, and it should take about 2 to 3 months. And if you look at the art down at the bottom, you can get a little bit of a spoiler there. It was not. It took us around 8 months, probably closer to 9. And the first piece that it drove home is different species have very different anatomy. They have different physical and physiologic responses, and those make a huge difference. And I should have known better, but I didn't. So why were we doing this? And this is important because I'm going to talk later about why having a goal and knowing the importance of the goal is going to be so valuable, especially when you're doing model development. Because you have to know, when is it no longer worth the time and effort you're putting in. But for us, it was, right? Because early in a drug development phase, that drug is rare. It's probably very hard to produce. It's incredibly expensive to produce because it's labor intensive. It's literally being made by hand. So you don't have much of it. It is the scarcest resource that you have. You can't waste it. So we needed something that was smaller than the common dogs and rabbits, because if you're dosing by kilogram, the lighter the animal, the less material you need. So normally you would go to rodents. Rodents aren't good in this case because they don't have the primary potassium hERG channel that is indicative of sudden cardiac death. So you need something that is going to match humans. It needs to be predictive. Needs to have a strong enough signal. So that's another problem with rodents. Their heart's very small, which means the electrical signal that it sends out is small, which means if you're trying to measure a waveform and it's tiny, it's really hard to measure it. And especially 20 years ago, most of the automated systems could not handle anything that didn't have an amplitude above 1 millisecond, or 1 millivolt. And in a rodent, you're looking at like 0.2. So everything would have to be done by hand, and that wasn't going to work either. But a ferret is small. It's around 800-900 grams, so much smaller than a rabbit or a canine. We've worked with it, in research as a model for a very long time. So we know how to work with them. We know the husbandry requirements. We know what kind of enrichment they need. That is well understood. And as a bonus, when you do that initial hERG channel assessment in vitro, so tabletop, you're using typically Purkinje fibers from the heart of a ferret. So from a regulatory standpoint, there's already some buy-in that they're the right model, because you can point to it and say, well, if those Purkinje fibers that we're looking at are good enough for the in vitro work, well, then they've got to be good enough for the in vivo work as well. So they seemed ideal. And they were, just not from a development phase. So here's the big reason. So a ferret runs anywhere from 700 to 800 grams to 1.1 to 1.2 kilos, which is a heck of a lot smaller than a rabbit or a canine. But for their body size, they have an enormous heart. And when you're measuring the electrical activity of the heart, the bigger the heart in relation to the body, the bigger the signal amplitude, so the easier it is to read that signal and measure it. And we encountered a whole host of unexpected things. The first is you have to cannulate an artery. You put a pressure cannula in place to be able to measure the blood pressure. You want an arterial line. Usually that's fairly straightforward, but in a ferret, it wasn't. Lots of fat, lots of fibrous tissue, and it wasn't easy to dissect. And in this case, the fibrous tissue that we were trying to work through was actually far tougher than the vessel we were trying to gain access to. And that's a problem, because the thing we most wanted to keep intact was the one that was most likely to fall apart. They also had some additional things. So standard transmitter is based off a standard, in this case, rodent. A ferret is much longer than a laboratory rat or a laboratory mouse. And so the various catheters and ECG leads weren't long enough. So we had to work within that too. But the good news is the ECG waveform was so strong that we actually had to move to pinpoint electrodes, because a normal ring loop picked up so much signal that it actually obliterated what we were trying to look at. So that was a good sign. It was actually going to give us what we needed. However, first thing to keep in mind with these types of animals is whatever you do, whatever model you create, it has to work for them when they're doing normal movement. And we picked the animal that ties itself into knots, literally ties itself into knots, turns its torso 360 degrees around from the hips. So a lot of movement. So everything we put in there had to be able to hold up to animals that move like this. And if you look down in the bottom left-hand corner, that's what happens when you put a standard polyurethane pressure cannula in an area that crosses the hip in a ferret. Just like if you take a wire and you bend it repeatedly until it starts to become brittle, it's exactly what happened here. It actually caused a change to the crystalline structure of the plastic. So that wasn't going to work. So the standard move to a femoral artery, have your transmitter placed subcutaneously, didn't work. Fair enough. So when we moved then into the body core, again, fairly common approach, use that for rodents all the time because their peripheral arteries are too small to cannulate. We found some more unexpected things, right? Because the animals that we work with, they don't necessarily read the anatomy textbooks. And so in this case, one of the things we found, not represented in the textbooks or literature, is that roughly 1 out of every 4 ferrets we worked with didn't have one aorta. They had 2 of them. They were bifurcated, running in parallel. Additionally, also atypical, the aorta itself was extremely fragile and filled with various branches coming off of it. So because of that, We had to use some rather different techniques to avoid damaging the aorta, having it tear, but also to occlude off all of those branches so we could isolate a segment. So if you look in the lower right, we went over to a CO2 surgical laser to make that arteriotomy, so to make the incision in the artery. And then also, both myself and the other surgeon had to grow additional arms with all of the different swabs and instruments that we had to use to gently push down on all of that collateral circulation to keep that area clear of blood. But so we had multiple surgeons now, new approaches that we'd never used before, and the introduction of that CO2 laser. And it still didn't work. Over 90% of those cannulas failed within 6 weeks. And what we found is that, again, going back to the animals move around a lot and they're pulling on all of this hardware, they expelled the catheters from the aorta, something I've never seen before in any other lab animal species. And it wasn't 1 or 2, it was 9 out of 10. Literally pushed them out of the aorta, walled them off with scar tissue, and no catheter. Or at least the catheter was no longer transmitting a signal. But we were close, right? And so we modified the catheter attachment with a pulley suture pattern. We also introduced the catheter into the abdomen in a different spot. And you got what you see here, right? Which is beautiful pressure waves, beautiful ECG waves. But nothing went as planned. And that's kind of where I want to start with the study design recommendations. As soon as you work with lab animals, nothing goes according to plan. You can minimize those, let's call them variations, but you can't eliminate them. So you have to account for them. So let's talk in vivo study design. There's a unique characteristic with in vivo studies that you don't see elsewhere. They use living animals. And beyond the fact that there are regulatory requirements, there are moral and ethical requirements for those working with them, the animals themselves introduce a tremendous amount of unpredictability. Are they going to be playful? Are they going to be less playful? Do they want to sleep? Do they not like the perfume that a technician is wearing? Do they really like the laundry detergent that your scrubs were in? All of these things are variables, and the way the animals respond to them tend to be individualistic. It also requires really specialized training for the staff. And speaking as a hiring manager, I wish there were far more people who had this type of experience and skill set, but there aren't. And so finding that team who really understands what they're doing and why they're doing it, has those specialized skills, is critical. And obviously that's critical in any study that we run, but it certainly adds a level of complexity to training those people. So you've got the variability that you must control for. Speaking as a study director, you've got to take the quirks of those animals and how those techniques are conducted into account. And I say must, and I suppose there are probably different opinions on that, and that's fair enough. But in my experience, if you design a study that doesn't have some inherent flexibility and some inherent accommodation to those, they will rear their ugly head and they will cause you massive amounts of problems. More to the point, when we get into the species, each one reacts differently. A rat and a mouse may look remarkably similar, but behaviorally, they're very, very different. A C57 mouse versus a tau knockout mouse behave completely differently. They have different anatomy. They have different collateral circulation. They have a different width of their head, which affects the width of their brain. So if you're trying to do an intracerebral ventricular injection, well, location's now different. All of these things matter. So choosing that right species and the correct strain and having staff who understand how to work with those species and those strains is usually, I say often, but I'm going to edit that to usually, is the difference between a successful and a failed study, even a partially failed study. And one thing that I'll put out there, because we've probably all been burned by this before, I certainly have. Especially in the in vivo space, most papers don't really talk about how the work was done. They talk about the results, but they don't tell you how they did the thing. And that tends to lead to a lot of reinventing of the wheel. But it also means what often happens is people without experience in the in vivo space, they find a paper that they feel is reflective of what they want to do. They don't have the background to understand why the decisions and the choices were made. And they basically say, let's mimic this. And unfortunately, and fairly frequently, there are, at best case, there were decisions made building that initial study that we don't understand, so we don't understand why they might not be applicable. Or worst case scenario, that study was designed by someone who did the same thing that you're potentially doing right now. Taking a previous study, mimicking it without necessarily understanding all of the things that come into it. And that is absolutely a recipe for failure. It's a recipe for variability. It's a recipe for things to go completely off the rails. We've all heard, the proper planning prevents poor performance, and that is absolutely true in here. Spending some additional time planning around these nuances is really going to be the difference between a successful and an unsuccessful study. And again, when we design any study, whether it's in vivo or in vitro, you're designing them around the available staff, around the various activity metrics. You can do this many of these activities in an hour. We probably want to give you a 10%, safety margin, so you can do this many things in this time. And in vivo studies are the same, but again, the variability is not just the people performing it now, it's the lab animals that they're working with. And so everything takes longer, and the more tightly scheduled your activities are, the more stressed the people. And unfortunately, the more stressed the people, the more the animals pick up on that, the more stressed they become, which makes things take even longer. And you can get into a really nasty feedback loop that way. So your margins are going to be longer. If you're looking at a study and you have no alternative, then so be it. But if you do have an alternative and you look and go, well, each of these activities should take exactly 30 seconds. So I should be able to get 3 activities done within a little over a minute. Best case scenario, maybe you can. Fairly frequently, that's not how it's going to work out. And if it was really critical that you get data. So let's take an example. I want an ECG measurement and a pharmacokinetic blood sample at 2 minutes after dosing. And I can accept a 30-second variance. I can probably get an ECG waveform, and I can probably get the blood within that 30-second window. So I take the ECG at 1 minute 45 seconds after, and then I immediately start the blood collection. But if anything goes wrong, you lose everything. So in those cases, it's important to prioritize what's the truly critical thing. Am I most interested in having a pharmacokinetic blood sample at the 2 minutes? Probably, actually. And so let's make sure that gets done on time. And let's put that ECG at 3 minutes or 5 minutes or somewhere where we have the ability to prioritize that critical activity. Because your animals get a say, they do. But there's a little bit of a secret weapon for you when you get into this, and that's acclimation and positive human contact, because ideally, you want the animals that we're working with to be working with us as well. And I put this out here because it's not talked about very often. And speaking to someone who's been doing this for 30 years, a little over now, we didn't pay enough attention to this 30 years ago. Absolutely did not. We've learned a lot since then. We're better, frankly, than we were then. But I will tell you from a lot of that experience, the more time you spend acclimating the animal and providing positive human contact, the better the study is going to go. The better acclimated the animals are, the more comfortable they are with us. So prioritizing. Let's go down there and work with the animals outside of the study. Let's give them enrichment. Let's give them food rewards. Let's give them toys that they don't commonly have exposure to. Let's hold them. Let's talk to them. Let's, rats love to be scratched on top of the head. They'll fall asleep in your arm after just a few rounds of that, which means they're not nervous. They're not apprehensive around the people anymore, which means you want to take them out of the cage. They're happy to be taken out of the cage. You take your blood sample and then you give them a treat and you scratch them on the back of the head and you put them back in the cage. Well, you've taken something that could be potentially uncomfortable for them, or at least not something that they're looking forward to. And now it's, as best we can tell, they look forward to that activity because of all the things around it. The nice thing is most of our laboratory animals are social animals, which means they do respond to that type of attention. It doesn't just have to be a dog, could be a pig, could be a goat, could be a rabbit. You may have to tailor your approach to them, and that's worth doing some research because the way you give positive human contact to a rabbit is different than a rat. But there are a lot of resources out there, and if you tailor it towards that species, it really, really matters. And also scientifically matters because the less stressed and more comfortable your animal is, the less they're dumping stress hormones, the lower their heart rate. If you have a stressed animal, the variability goes way up. Because even if the variability alone is bad, what happens if half the animals aren't stressed and half are? Well, that's a huge level of variability in your study. And I'd also point out, finally, those are important to the staff as well. Like, we have the privilege of working with these animals and knowing that we value this positive human contact. That's important for the people as well. But you got to budget the time. You've got to train the people to do it. And you've got to set the expectation that this is not a thing that we cut. This is as valuable as any other study activity. Talk a little bit about, we're always trying to push the envelope. What's your risk tolerance when you're looking at a non-traditional study design? So you haven't found anything in those papers. You haven't done anything that seems to answer the questions that you now have to answer. Will the regulatory agencies accept it? Are you sure how strong your signals that you're looking to measure are? Because do you need to figure that out before you design the study to measure them? How do you power your study? Over the years, the number of studies I've seen where we have an N of 6 in each group. Why? Because I always use 6 to 8. It's my rule of thumb. I always have 6 to 8 individuals in any test group. Sometimes that's too many, and sometimes it's not enough. So picking that generic off the shelf is not going to be your best approach. Also means if you're blazing a trail, there's no one asked for help. No one's set the path for you to follow. What if the unexpected happens? Does it tear apart your whole development plan? Do you have a 3-year plan that if this doesn't work, it all falls apart? And here's a scary thing. If you've never seen those results before, how do you know if they're wrong? How do you know if you made a mistake? So are you going to recognize those erroneous results? Bring in the ferret model. Thought it would take 2 to 3 months. Took us about 3/4 of a year. Do you have that much time? We fortunately did. And then all of the various unexpected things that come off of that. Again, if you're going to go down that non-traditional design, look through the regulatory guidance documents, reach out to the agencies. they are helpful. They will talk to you because they don't want you to do bad work. They don't want you to waste the lives of our animals. So go to them, ask for help, ask for guidance. What do you need to see for you to set the study that I'm working on? I've been a consultant in the past. I'm not now. So no sales pitch here, but consultants can be wonderfully useful. I've used them many a time because if I don't have the experience in an area, I would much rather bring in someone who does have it, who can guide me so I'm not wasting time and animals and all of the rest. You have to do your due diligence, right? Because can they actually do the things that they're saying? But I'd also put out there, if you're partnering with a consultant or a contract lab or another pharmaceutical or what have you, I'm going to strongly recommend don't treat them as a gun for hire. Like, treat them as partners, share information with them. Again, I've spent about a third of my career in the CRO space, and I've seen a lot of studies fall apart. And it hurts when you get to the end and like you're looking at someone who's wasted so much of their time and effort and resources. Like, that's not it's a non-trivial thing to set up those studies. And you know that if you'd had a couple additional pieces of information, you could have guided them into a study design or a methodology that would have made a successful study. But if you don't share information, nobody can help you. Touching briefly on pilot studies, I'm a huge fan. If you're not sure what's going to happen, don't go in to your $3.5 million study. Do a $20,000 study. Do something that answers one specific question. Everyone wants to get the most for their dollar, and that's fair. I certainly do. But by the same token, the more questions you try and answer in a small pilot study, the more chance there is that one answer obscures another. So if you can, focus on what is the critical thing that I need to learn, and then design your study to do that. And again, if you go in that non-traditional route, and you can use these where 90% of your non-traditional route is actually using established methods, cool. Can I figure out how to do that last 10% with these pilot studies? And you will see examples. Your compound is wonderful. It absolutely is the most effective compound ever seen. But when you put it into non-human primates, it has a really pronounced thrombolytic effect, which means that isn't going to the agencies. You put an implant on the top of the skull of a sheep, and you don't take into account that sheep like to butt things with their head. So that incredibly expensive and delicate instrument you put is now fragments. You place a catheter into the intrathecal space, and it irritates the space, which means the space walls it off with fibrous tissue and your catheter fails. We have a compound that is incredibly toxic in rabbits, but in no other species. Well, how does that directly relate to humans? Because it's sure as heck a concern at that point. A few random thoughts. As with any study, I don't think these are necessarily in vivo specific, but how do you recognize a study that's not giving you what you need? And how do you set your acceptance criteria at the beginning so you can pull the plug? Because a lot of time and a lot of effort has been invested over the years by heaven knows how many people continuing a study after it's no longer relevant. And you do. I've been in it. You get caught up in that sunk cost fallacy where it's like, I've put so much time and effort into this. Another push and I'll be fine. But if you've already failed the study, you're not going to bring it back at that point. So how do you cut your losses? How do you recognize when it's falling apart? Preferably while there's still time to course correct. But similarly, how do you recognize if it's succeeding? Right? Do you have markers along the way where you don't have to wait 6 months for all of your data to be analyzed and tabulated to know, I think this worked? And again, have you set specific goals? like, are you doing a box check exercise where I don't actually have a goal for the study? I'm just running the study for the sake of running the study. I'm not going to get anything useful out of it. And the regulatory agencies, when you do a box check study, they can smell it. And they're going to look and they're going to come back to you most likely and say, this isn't going to accomplish the goal because you didn't answer a question. I'm going to skim over some of this, but again, do you have a plan for your study? Do you have a sketch? A plan is good if you really know what you're in for, because you can practice, you can set up your contingencies, you've got milestones, but if you're not sure what's going to happen, you might want to have the flexibility of a sketch. A little harder to hold on to, but it also lets you readjust fairly quickly, and that can be tremendously valuable. Go through the literature, reach out to your contacts. One thing that I've found in the era of the internet that's just glorious, speaking to someone who's old enough to have to go to research laboratories and photocopy articles, well, now you can probably get an email and a phone number for the people who wrote the article, and most people are going to be pretty giving. So instead of trying to interpret the paper, if you find the one, this is the method, cool, reach out to the authors. They'll probably talk to you. And they might share a lot of things that aren't in the paper that will make your life a heck of a lot easier. I'm a trust but verify guy, so don't automatically trust the research. And also keep in mind, as I'm sure we're also all aware, the amount of people who publish their failures is really limited, right? So just because there's nothing in the literature about whatever you're trying to do not working, doesn't mean that a lot of people haven't. They're just not typically going to publish it. And again, when it gets to the in vivo space, the procedures are usually either just one sentence, which doesn't help you. Many times they're incorrect. So the person who wrote the article is not the person down in the lab doing the work. And the number of times I've reached out and got connected with the people down in the animal facility doing the work, and they're like, yeah, that's not actually what we did. What we actually did when it was successful was the following. Man, that's invaluable to be able to talk to those people. Which brings me to the last piece, the people, because they do actually kind of matter. If you're going to get into the in vivo space, and again, in vitro space as well, but I have found in the in vivo space, you have to have that network. You've got to have the colleagues, you've got to have your partners, you have to have the people to reach out to where they might not know the person to talk to. They may well know the person who knows the person. And now you're talking to someone who's actually done what you're trying to do. I mentioned reaching out to the authors. I mentioned happens a lot. The person writing the paper was not the person doing the work. And again, go to the various regulatory agencies, go to the FDA, and put your plan in front of them and take their critique to heart, because they're probably going to be the people determining whether you accomplished your goals or not. Here's where I'm going to kind of get to the very end, but I've seen this a lot. And by interest, full disclosure, when I started 31 years ago, I was a technician. I was the person down in the room doing the work. They're not widgets. They're really, really not. They are the critical specialists who are going to make your study successful or not. No study without them. If you want a high quality study, if you want high quality animal welfare, if you want a good study, boy, you need to be talking to them and you need to be looking out for them, because they're the ones who can give you the feedback. This is great study design. It's not going to be able to be run. And here's why. People are relationship driven, right? And I've coached study directors when I was working on the pharmaceutical side, and I was coaching the sponsors who work with the CROs or the small labs. One of the things I constantly hammered at was spend some time making them feel appreciated. Talk to them. Like, if you're on site, ask them how the study's going. Do you know their names? Again, it's such basic stuff, but if they know what the goal of the study is, and they can provide the specialized feedback that you wouldn't get otherwise because they know to look for a thing. Hey, this is CNS drug. It's going to work in Alzheimer's. And just so you're aware, the last 3 studies we've run, we've seen some really mild neurologic signs, but we're not expecting to see them. So we're not looking and monitoring in this study. Now you have an engaged person who, when they're working, can say, I know they didn't want me specifically to look for this, but I know it was a possibility and I'm seeing it, so I'm going to report it. And that's the difference between walking away thinking nothing appeared on the study, and it's because you didn't tell people to be on the alert for them. You want them to feel valued, because here's my litmus test. Technician leaves for the day and they're driving home and it's raining and they just want to go home and have dinner. And they suddenly have that moment of, did I remember to fast the animals? Did I prep the test material? I want them, whenever it's one of my studies, to think, you know what? That's the guy who brought us in donuts on the first day of the study. That's the person who asks me what I think. That's the person who makes me feel valued. You know what? I'm sure I did it. I'm going to turn around and I'm going to go check. Or I think that there's something wrong in the study protocol. I'm going to verify it. You want them to be that engaged in the study, because I will tell you the number of times it has saved my behind over the years, couldn't even count. So you may as well go for it. Again, when it gets into in vivo work, the classic, you can be fast, you can be high quality, you can be cheap, you can probably only get one of those. So be careful to pick the one. Be realistic. Make those milestones. Share with your partners. They're either partners or they're not. And if they're not partners, they're not helping you. Request a review from the regulatory agencies. And don't overlook those pilot studies, those smaller experiments. I can't tell you how many times, and sometimes it works, but I can't tell you how many times I've seen, or I've been the person who rolled the dice and it didn't work. And you would have been a hero if it did, but when it doesn't, boy, you're in a bad spot. So let's go back to the ferret piece. What did we learn? What did I learn from it? The good news is we had a development rationale. We knew what we were trying to accomplish. We had defined goals. We had a bunch of investment steps. So we didn't look after leaping. We planned and we did things methodically. We had that definition of when things were going to work. But we also knew how important the study was. So when we were sitting there occasionally for drinks after a very long day, why were we doing it? Like, why was this goal so important? We had that peer network that we reached out to, because a lot of the fixes that I described, they didn't come from our heads. They came from us talking to people who we knew, who said, why don't you try this? But we also created a development plan we didn't have a lot of relevant data. We thought we knew what was going to happen. We did not. We were arrogant. I was. That's the definition of hubris. We're sure that we're experienced enough that nothing's going to bite us, and it did. We didn't put enough pilot work in at the beginning. We had too many variables in those first studies, and it made it harder to figure out what was going wrong. And we set our expectations way too high. We're going to be done in a couple months. This is going to be easy. Like, if you're emotionally expecting an easy road and you don't get it, boy, does that knock the wind out of your sails. And with that, that's the end. So, questions?